What's going on, everybody? Dr. Thompson here with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Monday. It's been a long day for me. I'm excited to do this live broadcast about the last thing that we're going to talk about, the most commonly removed organs, that being the ovaries and the uterus. So if you're joining me right now, go ahead and say hello. Let me know where you're watching from. Give me a thumbs up. And make sure you share this with someone that you know who is suffering hormone issues, or specifically they've gotten their ovaries and their uterus removed. They've had a hysterectomy, or maybe they might be facing this reality and they want a different opinion. They want a different perspective. That's what we're going to go over tonight, is a different perspective in regards to the ovaries and the uterus. So if you're joining me, go ahead and say hello. I want to make sure, hopefully you guys can hear me okay. But let's go over the ovaries and the uterus. Now, this is the last one that we're going over about the most commonly removed organs. We've gone over the tonsils and the adenoids. We've gone over the gallbladder. We've gone over the appendix. Now we're going to talk about the ovaries and the uterus. A lot of you guys had also had asked regarding the thyroid. So I know that the thyroid is a commonly removed organ. I'll touch on this really quick before we get into the ovaries and the uterus. Does the thyroid need to be removed? Here's the thing. I really think the only time the thyroid should ever be removed is if you are facing some kind of thyroid cancer, okay? Which is a very slow growing cancer. Chances are, if you've had some kind of thyroid cancer, the signs, the symptoms have been going on for years. It's just a lot of times doctors and maybe even the patient, they don't know how to decipher these warning signs that you might be headed towards your thyroid having a very bad day. But the thing is when it comes to the ovaries, when it comes to uterus, when it comes to even the thyroid, is that we blame the thyroid gland as if that's the thing that got sick. But just remember this is the thing that is actually reacting to some other illness that's taking place inside the body. So guys, when you remove the organ, you're removing the symptom, you're not removing the cause. And if you can remove the cause, then the organ will be able to recover the way that it's supposed to. So hopefully that makes a lot of sense. So before we get into the ovaries and the uterus, guys, I'm going to tell you this is going to blow you out of the water. Just what I'm going to go over, you're going to look at, you're just going to be like, oh my goodness, I can't believe that this is happening so much to so many women. In fact, over 500,000 times per year that a woman gets her ovaries and uterus removed. In fact, a third of all women by the time they're 60 years of age will have these essential organs actually removed. So we're going to get into it in just a second. Michelle, how are you doing? Thanks for joining us. Judy, hope you're doing well. Tina, good to have you join us. Dawn and Joyce, thank you guys again from bottom of my heart for joining this. And guys, if you find this information useful, please make sure that you share this as well, so that we are actually working on restoring people rather than just manipulating people and with drugs and with surgery. We have to start figuring out the reason why so many women are getting their ovaries and their uterus removed, okay? All right, so let's go over the ovaries and the uterus, most commonly removed organs. Now, I have a question for you when we start. Here's the question. Is there a need for your ovaries and your uterus after menopause? It's an interesting question, because I remember I talked to someone not that long ago, and they said, yeah, when I went to my doctor, they said there is absolutely no need for an ovary, for ovaries or for a uterus after menopause. That organ's function has been served, and after menopause, there's no reason on earth that you should even keep it. In fact, sometimes they get their ovaries and their uterus removed just prophylactically because, heck, it just might get disease, so we might as well just take it out. So I'm going to give you tonight a different perspective on why you, in fact, still need your ovaries and your uterus. And I'm going to show you why after menopause. And I'm also going to show you why this gets sick and what you can actually do and where you can start as far as getting proper testing to make sure that you can keep the ovaries and the uterus and to make sure you keep this vital organ. I actually had a conversation with a woman about an hour before I got on this live. And I was going over her x-rays and her functional assessment questionnaire, and just so that we could set her up for the proper testing. So you can see here when she came in, she's 29 years of age, and she came in having problems with endometriosis. She had terrible issues with headaches, migraine headaches, and also had a lot of chronic neck pain. For all of those different things that she had going on, She was put on a medication. And most importantly, she wasn't put on any kind of plan. In fact, I asked her, I said, what is your doctor's plan moving forward? And she looked at me, she started crying. She said, there is no plan. There is no plan on what it's going to take in order to get me better. So number one, I asked her, I said, did they ever test your hormones? And we're not talking about just testing one specific form of estrogen, that being estradiol, or just testing maybe estradiol and progesterone. She had never even gotten any hormones tested whatsoever. So she hadn't had all the estrogens tested, hadn't had her stress hormones tested, hadn't had her progesterone tested. There was no hormone function whatsoever, or no hormone testing whatsoever. And in fact, they just gave her drugs that was completely just based off of symptoms. So what they did is she's gotten to the point where the endometriosis is so bad, where she's had a procedure in which they go out and they scrape some of the damage, some of the diseased tissue. So she's already had that done. But then what they did after that is they put her on drugs like Lupron, for example, that chemically induced menopause. So here's a woman who has the potential to be able to have kids, the potential to have a normal menstrual cycle, yet she was chemically manipulated to be put into a menopause so that she wouldn't have any of the symptoms of endometriosis. Now, they also said, you're going to be on this forever until you decide to have a hysterectomy. And once you have the hysterectomy, your ovaries and your uterus removed, then all of your problems are going to go away. And she was also told to not ever have any more kids unless you want to continue to get more sick. This is someone who is 29 years of age, and they were told never to have any more kids. And I asked her, I said, well, do you want more kids? And she said, yes, I want to be able to have more kids. But this is so sad that this is so common. And I feel it's not right that this is what is being done to so many women who are experiencing so many different types of hormone issues going on. So let's talk about what a hysterectomy is, guys. Guys, this is going to blow you out of the water. I touched on this on the last live on Saturday that I was going to talk about this, but you're going to actually see literally how medicine can be so extremely sexist. So a hysterectomy. So I don't know if you guys have actually gone back and looked as far as what a hysterectomy means. And I said this on Saturday, is that much of a doctor's diagnoses and a doctor's procedures are all based in Latin. And I think if we would just start calling it for what it is and start talking in English, you probably wouldn't be so scared of the diagnosis. Just like I said last week, fibromyalgia. Fibromyalgia is a really big word. And a lot of times people think, oh, I got this diagnosis of fibromyalgia. It sounds so scary. It sounds so complex. Yet when you actually break it down, that fibro means tendons and ligaments, myo means muscle, and algia means pain. So basically the diagnosis of fibromyalgia means I have pain in my muscles and tendons and ligaments. That's how they describe the diagnosis. If you look at arthritis, arthro means joint and itis means inflammation of. Arthritis means inflammation of a joint. That's all it means. So when you look at hysterectomy, if you go back and look at what it actually means in Latin, it is almost comical. So number one, it comes from the word hysteria. What does hysteria mean? Well, the old term for hysteria, when they started calling it a hysterectomy, is it was called an ungovernable emotional excess as caused by the womb. So they thought if that you are hysterical, or if you are emotional, or if you are not at a level mood, that this was called hysteria. And the reason why it was, or where it was actually coming from, was actually from your ovaries and your uterus. Now, what ectomy means is it means removal of. Thyroidectomy means removal of the thyroid. Lumpectomy means removal of a lump. Adenectomy means removal of the adenoids. So that ectomy means removal of. So basically what it means is removal of the womb that causes an ungovernable emotional excess. How sexist is that? So when you look at ladies and the difference between men and women, we are taught that men and women are supposed to act the same. And hormonally, it's not the case. Men aren't emotional because they have, or supposed to have, more testosterone. Women, just by nature of estrogens, are going to be more emotional. In fact, you can be 4 different people throughout your menstrual cycle. So, and that depends on the week of your menstrual cycle. Week 1, 2, 3, and 4, you're going to have different type of emotions based off of the hormones that are circulating, that are in line with the menstrual cycle. So here's what's crazy: over 500,000 are performed every single year. But why is the ovaries and uterus removed? Well, uterine fibroids. Remember, fibroids are caused by there's something hormonally that's happening that the tissue is just responding from. You also have endometriosis, which is an overgrowth of specific tissues within the uterus that is all guided by something happening hormonally. But the other interesting thing is pelvic inflammatory disease. So pelvic inflammatory disease is another reason why there's so much scarring caused by inflammation for these hysterectomies. Now, why do uterine fibroids, why the endometriosis, why does pelvic inflammatory disease, why does it happen? Well, I want you to remember this, is that when it comes to some form of dysfunction, and if it's very specific to an organ that is very hormonally sensitive, then you have to first look at and say, maybe I have an issue with these hormones. For example, guys, when you look at the prostate is only in men. It's very specific to men, but it's also, because it's specific to men, it's also going to be very sensitive to specific hormonal fluctuations. So this is why you can get known as benign prostatic hypertrophy due to an excess of specific androgens, okay? Specifically DHT, dihydrotestosterone, which is 10 times more potent than testosterone, but there's a reason why that testosterone will convert into DHT. This is why you can get swelling of the prostate. This is also why you can get tumors of the prostate. This is also a reason what causes men to bald as well and lose the hair on the legs. There's a very specific reason why. It's not the organ's problem. It is merely responding to hormonal fluctuations taking place inside the body. So when you look at the uterus, when you look at the ovaries, these are specific to the women, which means they are going to respond to hormonal fluctuations taking place, specifically progesterone and estrogen. Now you have to ask the question, well, if you got progesterone and estrogen, there's some kind of abnormal hormonal fluctuation that's taking place. What is causing it? And those hormones, they don't go crazy for no reason. They are responding to specific triggers that are taking place inside the body. And it's up to us as doctors to figure out what those triggers are, where those stressors actually are. So when it comes to uterine fibroids and endometriosis, this is caused by fluctuations of progesterone and estrogens. Now, when it also comes to pelvic inflammatory disease, you guys have heard about this. Just think of this. It's inflammation that is residing within the pelvis. And this can be caused by sexually transmitted diseases in which there's an infection to take place. And remember, how the body handles an infection is the immune system has to go in there. And when there's any kind of damage to any kind of tissue, it repairs and replaces it with scar tissue. So if you have an abnormal amount of scarring due to an STD, this is the reason why. And in some cases, you can have some permanent irreversible damage. I'm never saying that there's no reason that you should ever have a hysterectomy, but you should also figure out, why did you get the STD in the first place? Another thing can be due to trauma. An abortion, for example, can be a trauma that can cause a lot of pelvic inflammatory disease. Pelvic surgeries. Some of the pelvic surgeries, the most common one is going to be a cesarean section. So you have a C-section. Anytime that you cut into the abdomen and you actually cut into the uterus in order to remove the baby, is a trauma. And this can also cause pelvic inflammatory disease and cause an abnormal growth of scar tissue within that area. So there's a lot of different reasons why a doctor would actually recommend to have a hysterectomy. Now, guys, I'll always go back and say this. Have you properly been tested? Have you properly been tested? And I'm going to give you an example of a woman who is having a really bad day when it comes to her progesterone and her estrogens. And this right here is a classic case of someone who is going to have some level of endometriosis. So here's a woman in her late 30s. And you actually, when you look at this and you look over here on this Dutch test, you can see very low in testosterone. You can also see very low in progesterone, which helps to balance out the effects of the estrogen. And the progesterone also builds the womb up, or builds up the endometrial lining in order to prepare for pregnancy. So you can see very deficient in progesterone. But when you look at her estrogens, specifically estradiol, you can see just how much estrogen that was actually being, that she was keeping. And again, she's got these circulating estrogens. And so what happens is those hormones are reaching these very sensitive organs for women, like the breast tissue, like the uterine lining, and it's causing growth in through that area. Now, why was she producing too much estrogen? No, she wasn't producing too much estrogen. If you go down and you actually see her methylation activity, which is how the liver clears out those estrogens. And if the liver can't clear them out, all that happens is they keep building and building and building. So was her issue necessarily estrogen? No, her issue was that she could not detox from these hormones, which is actually a liver problem. Now, we've done some more testing on her, and she had a thyroid problem that was due to her liver. She had an abundance of estrogens that was due to her liver. So you guys have to go back and see why are these things? And the main issue was that her liver was having a very bad day. So the body can remove these estrogens by doing two different functions. The first one's called hydroxylation, which basically means adding an OH to it to make a hormone which is fat soluble into water soluble, and then to be able to methylase so that she can remove it through her gallbladder and then into her digestive system. 2 phases of detoxification. So she needs to be detoxed in order to improve her liver function. And I always laugh when people say, oh, detox is stupid. You shouldn't do it. Your liver and kidneys already do it already. They're supposed to do it. But if you're doing things that are causing these enzyme pathways to get bogged down and not work the way that they're supposed to, then the liver is going to have a bad day. So what are some of the things that can really bog down the liver? These are things that first start off by what you're doing with your lifestyle. So guys, if you're consuming too much high fructose corn syrup, my goodness, this is why we tell some people don't eat any fruit, because your livers can't process it very well. So high fructose corn syrup. How about any kind of hydrogenated oils or partially hydrogenated oils? These are things in your lifestyle that we start consuming at a very young age, And we think, oh, there's no consequence with doing it. But here's the consequence. The consequence is when this woman is in her late 30s. So you can see, looking at this, she needs to improve her liver function in order for her to be able to clear out those estrogens so they're not recirculating all the time and they're causing that growth and that buildup of her breast tissue and of her endometrial lining. So this is true when it comes to breast cancer. There's 2 problems with breast cancer. Number 1, the problem is she's got too many circulating estrogens that cause growth of the actual ducts within the breast. And then the other thing is, then you have to have a very weak immune system that the immune system can't go in and be able to identify any kind of tumor cells or abnormal cells to be able to kill it. So you can see here that this is what is one of the things that you're going to classically see when it comes to endometriosis. So let's talk about the function of the ovaries and the uterus even after menopause, or like menopause. But does it mean that once you have menopause, you're just supposed to get these organs out? Not a chance. But most doctors think there is no function of this organ after menopause. And just remember this, guys, any doctor that says they know everything about the body right now is 100% false. We do not know everything about the body. We are not God. We don't understand everything, and we're learning new things all the time. And this is why I say this. I say I want to work with the body. I'm not God. I am not going to decide if someone needs an organ removed or not, because I understand that if you did not need the ovaries and the uterus, then at menopause, those organs would disintegrate, but they're still there. They still serve a function. And in fact, this comes from the Merck manual. So the Merck manual, they said this: for most women, age-related change in reproductive organs do not interfere with sexual activity or sexual pleasure after menopause. Some women enjoy sexual activity more after menopause, possibly because they're no longer concerned about being pregnant. But in addition, pay attention to this. After menopause, the ovaries and the adrenal glands continue to produce male sex hormones. Male sex hormones, specifically like testosterone or androstenedione, DHEA, things like that, help to maintain the sex drive slow the loss of muscle tissue, and contribute to an overall sense of well-being. So even after menopause, the ovaries continue to produce testosterone, which is needed even in women. So if you don't then remove the ovaries, you're going to become testosterone deficient, which is testosterone, if you look at it, is one of the things to help you maintain muscle mass. And it's also needed in order to be able to lose weight. And how many women do you know after they get a hysterectomy start to put on so much weight? That is the reason why. Here's another article about the ovaries. This comes from the National Library of Medicine. And here's what it says. Circulating androgen levels before after oophorectomy or removal of the ovaries in premenopausal and postmenopausal women, their conclusion was this: the significant decrease in serum testosterone in postmenopausal women following removal of the ovary adds to the evidence that the postmenopausal ovary continues to produce testosterone. So you still need testosterone. Testosterone for women still serves a critical function for so many different things. So the ovaries continue to work even after menopause. Now, what about the uterus? In the uterus, here's what they say. Hysterectomy may be linked to brain function. And here's what they found. This study is the first of its kind to link the uterus to brain function by using a rat model of hysterectomy to show its effect on cognitive abilities, including memory and thinking skills. Did you just hear that? That they know that the uterus is tied into the brain and plays a role in memory and critical thinking skills, which means when you remove it, you then start messing with brain function. So guys, do you need your ovaries? Do you need your uterus after menopause? Yes. We need to stop ripping them out like they're nobody's business and thinking that you don't need them before. And in fact, if you have had a hysterectomy, I want you to comment right now if you're comfortable doing that, but comment, did you feel better or worse after the hysterectomy, specifically when it came to 6 months later in regards to your hormone function, and number two, your memory and your ability to be able to think and process thought? Let me know what your thoughts actually are. So here's the question or a statement. A sick uterus and ovaries are a symptom of a much larger problem. And it's a problem of inflammation. It's a problem of liver function. And it's a problem with hormones responding to inflammation and to a liver problem. So guys, we're removing organs, and the organs are just the symptom. They are part of a much larger problem. And when you remove an organ without fixing the underlying condition, you just don't have the symptom anymore, but you still say sick. You still say sick. So we have to start getting to the reason why. So guys, if you're contemplating having your organs removed or uterus and ovaries removed, figure out what's causing it first so that you can save those critical hormones. Maybe you've already had the ovaries and uterus removed. Maybe you've already had a hysterectomy. Here's the thing. Have you gotten your hormones tested? And have you figured out why it got sick in the first place? Because even if you have it removed, doesn't mean you're healthy. Removal of an organ does not mean that you are healthier as a result. It just means that you took out the thing that was crying the most, that was the loudest, that was causing the most amount of symptoms. And guys, if we can get back to this is how we change healthcare. The Swiss watch principle. We have to understand that the endocrine system affects the digestive system. The digestive system actually affects the immune system. That the immune system is affected by the circulatory system. That the nerve system affects the respiratory system. We have to stop looking at our bodies as a bunch of tiny little pieces that if they go wrong, you can just remove them and it not affect all other organ functions inside the body. One of the greatest things that we do with our approach, with our wellness way approach, is we figure out how to look at all those organ systems and then figure out what is going on. Right now, if someone is having a hormone issue, something is stressing the body, and it's up to us to figure out, Where's the chemical stress? Where's the physical stressors? Where's the mental stressors? And if you can start removing those three, the body knows how to recover. It knows how to heal, and it will do it 100% as long as these stressors are removed. So do you know what your stressors are? Do you know what your tests are? And have you gotten properly tested? And if you haven't, what's your plan? Is it to continue to remove organs, or is it for restoration? That's my question for you. So do you want to be restored, or do you want to be manipulated? The choice is yours. And if you want to be restored, then seek out our help, or seek out a help of a Wellness Way doctor who knows how to start restoring the body like a carpenter versus putting out fires like the fire department. So we talked a lot about ladies, but coming up, we're going to talk about men specifically. So guys, if you are in the Yorkville area, and because most women are the ones that are watching this, but if you have a man and you want him to man up. So what do I mean by man up? What I mean is how do we raise a man's testosterone back to where it should be? You have no idea how many men actually admit to me that they're very testosterone deficient. The number I can tell you is 0. But do you know how many women, when I'm doing a consultation, they come to me and they say, do you think you can help my spouse? Because he's got no motivation. He's got erectile problems. He has no sexual desire. He has fat. He has no muscle mass. He has no energy. He's got no desire to do anything other than just sit on the couch, sleep late, and watch a bunch of football. So coming up, this is going to be July 18th. We're going to be doing an event at our office called Man Up, and we're going to show men what they can do in order to raise their testosterone. And I say this without the gimmicks, because there's a lot of gimmicks out there right now, a lot of gimmicks that say if you just take this, this, and this, it's going to raise your testosterone. You're going to feel like $1 million. But I'm going to show you that if these pathways are off and you do not fix your lifestyle, then what'll happen is even those gimmicks will even turn it back into estrogens. And then you continue to have bad days. So we're going to talk about how you fix lifestyle first without all of these gimmicks, without any kind of exogenous testosterone, without any injections, without the underarm testosterone, and without all of these things that you get from GNC to try to raise your testosterone, which will work for a little bit. But if these pathways are off, you just continue to create more and more damage. So on this event, so I'm going to drop the link in the comments below. Make sure that you share this with your man. Get them registered. There's no cost to come to the event. And at that event, we're also going to go over what we're going to do for 4 weeks of mentorship on how we're going to do it when it comes to nutrition, how we're going to do it when it comes to how you work out. And we're also going to be doing some things that are going to involve a Navy SEAL. So we have a special guest, a Navy SEAL, that is going to show us some things in regards to mindset, motivation, but also a little bit of hand-to-hand close quarter combat and some cool things like that. So it's going to be 4 weeks of mentorship. It's going to be absolutely incredible. But we want to take men through this, and we want to help men regain that fire, that passion that they had when their testosterone was at their highest. I've been there. I've helped to overcome it as well. And more men need this than ever before, because men's average testosterone has dropped by 40% just in the last 20 to 30 years, and it's getting even worse. So let's help men become the men that they always wanted to again. And make sure you register for this event. It's going to be July 18th. It's going to be at our office starting at 10 o'clock until 11:30. We got a lot of awesome stuff planned for those. So make sure that you share that with your man, or just let them know, honey, you're coming, or else it's going to be a bad day for you. So guys, I appreciate you guys joining us. Guys, have an awesome Monday evening. We will talk to you soon. And if you have a topic that you want to hear about, just let us know in the comments below. And then we can do that for any kind of future lives. So guys, be well, be awesome. We will see you guys very soon. We'll see you.